The idea for Streetside Medics was born after an experience I had with a gentleman who was experiencing a seizure in London. I was a final year medical student doing an elective at the Imperial College, and when I walked out of the train station, I saw someone having a seizure. I did my vitals and my ABCs and kept him stabilised, and I later learnt that this gentleman was homeless. I was having a conversation with some of the people that were surrounding him, of whom many were homeless, and upon questioning I learnt that they had a real sense that their health needs and the healthcare system cared less for them than any other average person in society. I couldn't sleep after that, and as someone who had dedicated their life to becoming a doctor and to providing healthcare for the entire community, I couldn't just stop thinking about it. I came back to New South Wales, where I live, and I did my research, and I learnt that despite the best healthcare system in the world, there are a number of complex and challenging barriers which limits access to healthcare. Coupled with that knowledge and mentors and expertise in the area, I decided to start Streetside Medics. Streetside Medics is a GP-led mobile medical service which is dedicated to those experiencing homelessness. We started in July of 2020 with 2 volunteers, and we've grown the team now to 220 volunteers with 2 vans and currently 4 clinical locations, having served over 500 patients. We take our van, which is set up as a medical clinic, with doctors and allied health and a team of volunteers, to food services and shelters across New South Wales. We provide our services free of charge, without the need of Medicare or ID. As Streetside Medics, we are dedicated to this population. We are dedicated to striving to alleviate these barriers, which do limit access to healthcare. There are 116,000 people in Australia experiencing homelessness, 7% of which are rough sleeping, and no one should be unable to access healthcare in Australia. We have the best healthcare system in the world, and really this means that we'll expand our service, hopefully interstate, and I don't want to leave a single person unable to access healthcare. So I believe Streetside Medics has seen a great uptake of volunteers for a number of reasons, but predominantly it's due to the satisfaction that one gets at the end of a clinic. Seeing someone who may be experiencing a medical illness they didn't know about, that led to them feeling physically unwell, and seeing the improvement that we can make on their life is such a great feeling, one that really can't be replicated. And I think this team at Streetside Medics really is passionately trying to improve the lives of those people we are serving. Not only that, the people that we're serving are such interesting people with unique stories from a wide range of backgrounds. And you learn so much from going to the clinics, you learn so much from talking to these people. And it truly is a privilege and an absolute honour to be able to serve the community of people who are experiencing homelessness. Really, they are deserving of the most exceptional healthcare available to them.